So lovely to get all of your New Year's Eve greetings. Thank you to Neville and to Isabella too. Isabella is off the Candy Pan. Oh, I love the sound of that. Going to the W Hotel at the Palm. It's going to be the first time there and looking forward to it. And Neville wishing all of us here at Dubai Eye 103.8 a happy and healthy 2025. Same to you, sir. What are your plans for tonight? Are you staying in? Are you going out? And if you're going out, where? So, as we usher in 2025, the UAE is taking a landmark step towards ensuring healthier families and future generations. Starting in early January, the Ministry of Health and Prevention is going to be implementing mandatory genetic testing as part of its premarital screening for all Emiratis planning to marry. So, this initiative really underscores the nation's commitment to proactive healthcare and the prevention of genetic diseases. So to unpack this and answer any questions that you might have about genetic testing, whether it is premarital, in children and adults, Dr. Ayman El-Hattab is consultant in clinical genetics. He's there at Genesis, among others, to explain the significance of genetic testing, the types of conditions it can help identify, and how it can shape the future of family health here in the UAE. Dr. Ayman, how are you this afternoon?
I'm good, thank you. Thank you very much, Helen.
And you're happy to take some questions if anyone wants to get in touch?
Absolutely.
Perfect. Now, I want you to talk to me as if I am a child and really bottom line it, because if you get too technical, I will have to stop you. But can we start by explaining what genetic diseases are and maybe provide some examples of conditions that genetic testing can identify?
Absolutely, yes. So we have like really large number of diseases that can have different manifestations, and they can appear at different age groups. But the common thing among all these conditions is the cause. All these conditions are caused by a defect in a gene or a chromosome. So different conditions caused by defect in a gene or a chromosome, we all call these as genetic diseases. And if we need to give like a classic example for a chromosomal disease, is Down syndrome, for example, when we have extra copy of a chromosome 21. For genetic diseases or single gene disorders, we can have like a defect in one of the genes responsible for hemoglobin, causing thalassemia or sickle cell anemia, for example. We have defects in another gene causing cystic fibrosis. We have many diseases caused by defects in genes responsible for enzymes, resulting in metabolic diseases. We have large number of defects in genes that are responsible for brain development, leading to developmental delays, seizures. Sometimes we have like growth failure, congenital malformation, hearing impairment can be inherited, disease affecting eyes. If we want to expand also more, we can talk about like hereditary cancer.
That's what I was going to ask you. We were talking about colon cancer just a week or so ago, and unfortunately a rise in under 50s having colon cancer. And my father had it. So I'm particularly kind of attuned to that aspect of it, because I have so many doctors in the studio who are talking about personality traits being genetic, about certain types of cancers being genetic. And really, sometimes it's a case of the genes loads the gun, but, lifestyle factors and just, personal decisions can really fire it. So when we're talking about genetic testing, why is that evaluation so critical, especially what we're talking about today in the context of a premarital screening program?
Yeah, so we always aim or try to find out a reason. So if you have a child with, let's say, developmental delay, the child is delayed, has delays in walking or talking or development, then we try to find out the reason. We need to test, to evaluate the child and do genetic tests, try to find out a specific diagnosis. If you have a specific diagnosis, first, you may have a specific name for this condition, and this name is associated with information. So parents will know more about their child's condition. At the same time, treating physicians will be able to provide better care.
So how does it work? And I really want you to explain this in terms of, let's use the recent news. So you have an Emirati couple who are planning to marry, and they come to see you and say, "Hi, doctor, this is our plan. We're going to build a family together." Do you take a blood sample from each and you send it off to a lab and then you screen for everything? Or do you have to test for specific conditions and narrow it down? How does it work?
Yeah. If you allow me first, let's say that we do genetic testing for two reasons. One for diagnosis. These are for diagnostic when you have someone with a disease and you are trying to find an answer why this person has this disease. And also we can use genetic testing for screening. Because here, the example you asked, when we have a couple, we can screen them for the diseases that they carry. Because now, again, we have like different types of genetic conditions, but if we, in particular, we are talking about autosomal recessive diseases. These are the diseases where both husband and wife are carriers. If they are carriers for the same condition, then there will be a chance for the child to be affected. So there is no way to know what diseases anyone carries unless we do genetic testing. So for couples, yes, we can take a blood sample from both. And now there are different options. We can test for a specific list of genes, or actually we can test all the genes. So it depends. So we can use gene panel, or at the same time we can use what we call it whole exome sequencing to look at all the genes, and then we will have the list that the husband carries and the list that wife carries, and it's normal for every one of us to carry conditions.
That's what I wanted to ask you, because I'm sure there's a huge amount of what, people in the cancer community talk about scanxiety, getting results back. Is it quite normal then for everyone listening today to be carrying something, and presumably it's only when perhaps you're with a specific person who has issues as well that this would be a problem?
Absolutely, yes. This is normal for every one of us carries like 5, 6, 7 conditions.
I want to know what I have now.
There is no way unless you do the test.
Oh, gosh, that's so interesting. And then tell us a little bit then about what next. Let's say, unfortunately, both man and woman are carrying a genetic condition that, should they conceive naturally together, there'd be an increased risk of their child carrying that. Do you then work with a team of people in terms of helping them safely conceive? Are you able to do screening, for an embryo or egg or sperm?
So when we have couples who are carriers for the same condition, so the first and most important step is to counsel them, to sit with them, to explain things for them. Because if we don't really provide proper counseling, they may not understand the information and they may not do the right actions. Then it depends on the condition. I mean, sometimes we have like mild conditions that they decide to conceive naturally. But many times, unfortunately, these conditions are severe. And if both are carriers for the same recessive disease, the risk will be 25% to have an affected child. So typically, we tell them about the option of doing IVF. So when they do in vitro fertilization, they create several embryos. And if we know that both are carriers for a specific disease, then we can test all the embryos. And then one unaffected embryo can be selected, transferred back to the mother. Then you know that the coming baby is not affected.
That's amazing. Dr. Ayman is in the studio, Dr. Ayman El-Hattab. If you want his details, send me the word doc. I'd be very happy to connect you there. But some really interesting questions, some interesting points coming in on 4001. One asking about testing for dementia in adults. Can that be useful? We've had a message asking, are your genetic tests to remain private? How can you ensure that information won't be shared? And Ruth wants to know, my father has a genetic condition that causes blindness. She says IRD. And while I'm only 26 and not in a relationship, the thought of having this and passing on to my child terrifies me. So what are my options? No such thing as a silly question. If you want clarity, if you want any specific advice, do reach out. You can be anonymous on 4001. You can use the ARN Play app or give us a call. Same number as the WhatsApp, 04871 5500.
Dubai Eye 103.8 traffic.
With Yas Island Abu Dhabi. Stay at iconic hotels and play at record-breaking theme parks. Book now on yasisland.com.
It is 14 minutes past 3. Milani's in the studio with the latest on the roads. I'm guessing people are starting to make some moves for their New Year's plans, Milani.
Exactly, Helen. Exactly. Good afternoon, everyone. Traffic on the E11 to Sheikh Zayed Road, light to moderate. This is northbound around Al Quoz and becoming heavier from Dubai Mall area until you reach the Trade Center roundabout. Same on the E44 Al Khail Road. This is around Al Quoz Pond Park. That is also northbound. Now looking on both the E11 and the E311 from Dubai to Sharjah, very, very slow coming from around Al Garhood until you reach Al Majaz Sharjah. And on the E311, slowdown starts from International City Phase 2 until Muela Commercial. So you will experience about more than an hour delay, especially on the E311. Same on the E611 as well. There's the Emirates Road coming from the E44 until you reach Al Kawanij in Dubai. If you want to add anything else, text us on 4001. Please drive safely.
Thank you, Milani.
Dubai Eye 103.8 traffic.
And let me know, what are your plans for this evening? Jen, Chin, Amelia and Aaron are off to the mountains. They've just messaged saying in Iraq, camping with friends, a tradition that we love. Happy New Year, Helen. Hoping 2025 is a fabulous one. Me too. I have to say, heading for the hills sounds pretty darn appealing right now. Have an absolutely brilliant time, guys. Let me know where you're going. If you want a New Year's Eve shout out, or do you got any questions for our doctor of the hour, you can get in touch on 4001, the app and the WhatsApp.
More of Afternoons with Helen Farmer is coming up next.
On the UAE's #1 talk radio.
Elton John with Rocket Man here on Dubai Eye 103.8. We're talking genetic testing now. Genetics loads the gun, but lifestyle pulls the trigger is the common quote. But why should we? Well, is more information more useful? We're exploring that now. Dr. Ayman El-Hattab is with us in the studio, consultant in clinical genetics. He practices in Al Ain in Abu Dhabi and here in Dubai at Genesis. And some really interesting messages coming in for you, Doctor. We've just heard that from early January, pre-marital screening program for all Emiratis planning to marry will be underway. But we're opening it up to not just Emiratis, but and not just before you marry, but also testing that can be done on children, on adults, some preventative screening, which is really, really fascinating. And we've had a number of messages. Ben's asking here, saying, does your doctor recommend testing for dementia and Alzheimer's? Is that something that you've done in clinic?
So I think the first thing is to differentiate between what we call the multifactorial disorders and single gene disorders. So any disease, you can consider it as genetics, even like diabetes, hypertension. That statement you have said, we have like multiple genetic factors with multiple environmental factors will make this disease appear. Now for these multifactorial tests, the disorders, typically we don't do specific genetic testing for. We are focusing on single gene disorders. We have defect in one gene, then you have one disorder. For this, yes, we do test to make a diagnosis.
So let's go back to my example earlier, saying, my dad's had colon cancer, and I believe there is quite a strong genetic component of that. Let's say I come in for some screening and some testing. What do I do with that information? You could sit down and go, Helen, you do have a propensity, you've got an increased risk of having this type of cancer. I feel like I would just then live in fear. Or, how does that information then inform change to hopefully prevent or delay something?
Yeah, I know that such information are really very important. Now we have two scenarios. Let's talk about like the more classic scenario. If we have someone with colon cancer or any type of cancer, and that affected person has done genetic testing, and we identify a specific mutation that caused that cancer in that person. Now, typically these are inherited as we call them dominant. So there is 50% chance for the children of that person to carry the same mutation. And in this way, people who carry the mutation, not like 100% they will have tumors, but the risk will be higher. Mm-hmm. So if I know that, and we typically recommend testing all other family members to know who carries the variant and who doesn't carry the genetic change. People who carry the genetic change will have higher risk, and they will be encouraged to do more screening, more surveillance than people who do not carry these variants. Like anyone should do like a screening, but in particular people with genetic changes make their risk higher. They should do more frequent at earlier age, aiming to, if I will have that tumor, then diagnosis will be earlier and the outcome will be better.
And I would, draw parallels there with like the BRCA gene for breast cancer. And, I've had friends who've had preventative mastectomies because of carrying that gene in their early 20s. And again, have felt they're more in control of, their health and their journey. If you've got any questions, do get in touch. Dr. Ayman with us this afternoon, consultant in clinical genetics. So let's go back to that counselling piece about the premarital screening. Can you talk us through maybe different types of genetic tests available, how they're used to diagnose various conditions, especially when we're thinking about premarital screenings? What are you looking for?
So first we do genetic sequence. We sequence genes, and this of course can be done by like a blood sample where they extract the DNA and they do sequencing, and it depends on the screening that you do. So you can select a group of conditions, a group of genes, and you can do sequencing for these genes to see what conditions the man carries and what are the conditions that the wife carries and do the match to see if something in common. At the same time, this is called like gene panel. You can perform gene panel, but also you can do tests for all the genes, what we call it like whole exome or whole genome sequencing. This also can be done where you test all the genes and determine, same thing, which conditions the man carries and which conditions the wife carries and do the match.
So understanding kind of inheritance patterns seems like a really vital part of genetic counselling. Can you briefly explain the different types of inheritance, so the recessive, the dominant, the X-linked, and some of those implications? Absolutely.
So let's start with what's most important for the screening is the recessive. The recessive, here we have the husband is a carrier, unaffected, so you can be just carrier for the condition, and the wife is also carrier, and then the chance to have an affected child is 25% with every pregnancy. Here there is no way to know that you carry this condition unless you have an affected child, which is the typical story. You have a child, then you diagnose the child with a recessive disease and find out that both parents are carriers.
Well, this is what happened last time we spoke about genetic testing on the show. We had a husband contact us saying that he was married to his first cousin, and their first child, and if my memory serves, I think was having problems with sweat glands and had no fingernails. So you're nodding as if I was really shocked by this. I don't think anything surprises you, Dr. Ayman. And his question was, what can we do to prevent problems with future children? So in that situation, they were clearly unaware that there was a genetic issue until they'd had their first baby. So in that situation, is it possible then to do the screening before a second pregnancy? And then, as you mentioned earlier, go down the IVF route and scan, test the embryos?
Absolutely. So this is what we used to do. So we test the affected child, we find out the mutation, the gene, which gene is affected, and then we know that both parents are carriers. Then for the second child, yes, people can do IVF and testing the embryos. But premarital screening, or let's call it preconception, because couple may be married but they don't have children yet. Why to wait to have an affected child? So can we do tests for the husband and wife to see if both are carriers for the same condition, and then from the first pregnancy, then they can proceed with IVF and prevent having an affected child.
We're going to continue to unpack this further and, of course, take your questions. Dr. Ayman El-Hattab is in the studio, consultant at clinical genetics. We are going to be going to the text line. Ruth's been in touch about an eye condition. We've had concerns about test results being private. Lola asking what happens if only one of us is found to be a carrier for a condition. Does that still pose a risk for our future children? So all of this and more. If there's anything that is coming to mind for you, any red flags, any worries, any clarification needed, you can get in touch on 4001. You've got the app, of course, and the WhatsApp too. You don't need to put your name on the message. It makes absolutely no odds to us at all. Just a great opportunity to get some much needed advice.
Your ARN News.
Good afternoon from the ARN News Centre. I'm
It's the Plain White Teas. You're listening to Dubai Eye 103.8. It is New Year's Eve. It is 3:40 and I'm Helen Farmer. Dr. Ayman El-Hattab is in the studio, consultant in clinical genetics. We should be very clear when we're talking about clinical genetics, we're talking about screening for disorders and conditions, not about do you have a long-lost cousin. That's a show for a different day. And we are, of course, talking about this premarital screening programme for all Emiratis planning to marry, but actually opening up the conversation to all nationalities and conditions in children, adults and preconception too. You can get in touch on 4001 if you've got any questions, need some clarity. We're very happy to help. So, Doctor, with this new mandate, what impact do you anticipate the premarital genetic testing programme have on the healthcare system here in the UAE and I guess well-being of families as well?
Absolutely. Like the main goal is to reduce the number of people affected with inherited genetic conditions. Now, if when this program is applied and everyone is doing it, then couples who carry the same condition, then they will do other procedures to prevent having affected children. So on the long run, we are expecting to see less and less of children affected with genetic conditions, which this will also, of course, will affect in a positive way the healthcare system, and at the same time the families who you can imagine that having a child with a severe condition, how much time and effort having such child will require from his parents. So of course, we expect such screening to reduce the number of affected children. That will positively help the families and the society and the healthcare system.
Thanks, Doctor. We're going to go to the text line 4001. Ruth is saying, my father has a genetic condition that causes blindness. She's put in brackets IRD, which I'm guessing is something to do with retinal. I don't know. I'm only 26. I'm not in a relationship, but the thought of having this and passing it on to my child terrifies me. What are my options now? So we're talking about premarital screening and, when you're with your partner. But for Ruth, who knows that there's a genetic condition in her family, is it worth getting screened now, or should you wait until you're with someone that you plan to start a family with?
So this is the really common questions where we receive question like one of the family has a specific condition, and it's very important to know the specific gene causing the condition. So the advice is always, for the affected person, please, let's do genetic tests for the affected person to understand first, to know the gene and understand the inheritance. Is it like recessive or dominant? And what is the chance for her to have the condition herself, or for her to pass the condition for her children? So the key here is really to find out the exact gene that is causing them defect in her father.
And this could be done, in this case it's Ruth's father, so he is around that. But as we touched on earlier, if there has been a child born with a genetic condition, or even fetal tissue, if there has been a loss, that could be tested as well. Is that right?
Now, in general, we prefer testing affected person. If the child has a condition, then yes, we need to test the child. Sometimes we have, during pregnancy, we identify a fetus with abnormalities. And by the way, we can do genetic tests for fetus by taking a sample from the placenta, what we call it CVS, or from the liquid surrounding the baby, or amniocentesis, and we can test chromosomes, we can test genes. So it's always very helpful to try to find out the reason for the condition that we are dealing with.
A message here, anonymous, and you can, of course, leave your name off, saying, will our genetic test results remain private, and how can I ensure this information won't be shared with others? Great question.
Yes. Typically, when we do genetic tests, through any hospital, then all health information are kept privately. They will not be shared by anyone. The only way is the patient is the only person who has the right to disclose genetic test results or anything else. But no, genetic test results remain in the electronic health records, and no one can access them.
Don't worry, anonymous. You can stay anonymous. And again, no name on this one, saying there seems to be an increased number of kids being diagnosed with ASD, so autism spectrum disorder. Is there a genetic link to this? Now, this is really interesting because there seems to be more and more research talking about ADHD being genetic, people doing brain scans, an awful lot. We're actually going to be talking about ADHD in adult women on Thursday. But I've got friends who found out that they had ADHD because their child was undergoing tests. Now, with ASD, what do we know about autism?
So it's the same, like for the ADHD and autism and most of behavioral disorders, most of these conditions, we still don't have any specific reason for them. But small percentage of children with autism, if you do genetic test for, you'll identify mutations causing the autism. So it is recommended to do genetic tests for children with autism, ADHD, or any behavioral or learning difficulties. But the expectation is more likely that you will get negative results. But sometimes, yes, you'll find mutation explaining what you see.
That's interesting, because this message saying there seems to be an increased number of kids being diagnosed, and that doesn't necessarily tie to increased number of children being on the spectrum. it's most likely to do with more awareness and more testing and, more investigations. Now, when it comes to testing children, with that information, obviously there's this idea of being able to prevent any issues in future pregnancies. But are there any examples of conditions that you've identified through genetic testing in a child that's led to them having medication or treatment that's been able to do a real U-turn in their life and health?
Yes, thank you. This is very important. Yes, around let's say we have about more than 10,000 rare diseases. Only maybe 500 or so they have a specific treatment. Some examples are inborn errors of metabolism or metabolic diseases. Yes, making a diagnosis will enable us to initiate a specific treatment, specific diet or supplements that really will help the child. We have also many conditions now they have gene therapy, and the list is increasing. Some neuromuscular disorders now they have gene therapy. So finding a specific diagnosis will help us directly in providing like specific treatment. But even for the conditions that we don't have a treatment for, knowing a specific diagnosis will provide information. And when physicians know what conditions they are dealing with, sometimes they can choose the more suitable treatment for this condition, or the things that they know that may help.
And greater understanding from a parental point of view in terms of what you're dealing with, what your options are. It's all information. Jamil saying, hi both. If I already have children but didn't undergo genetic testing before marriage, should I consider it now for future pregnancies? We're not Emirati, Jamil says.
The answer is simply yes, because like for recessive conditions, we said that chance for having an affected child is 25% with every pregnancy. So maybe we got lucky with the first child, second child, third child, but yes, it's recommended for everyone to do genetic screening.
Of course, I'm going to talk money next. We've had a couple of messages asking how much. Joining us in studio today, consultant in clinical genetics, Dr. Ayman El-Hattab. He works between Abu Dhabi in Al Ain and here in Dubai at Genesis. If you want his details, you can just send me the word doc or doctor. I'd be very happy to connect you. Yeah, we will talk about money. I think that's a worthwhile conversation. And Lola asking, what happens if only one of us is found to be a carrier for a condition? Does that still pose a risk to our future children? Lola, we're coming to that after this.
Weather check.
With Air Arabia, explore Muscat, Milan, Athens, the Maldives, Istanbul.
It's Justin Beaver. You're listening to Dubai Eye 103.8. Do stay with us all the way through the evening. Lucy and Dane of The Debrief are, of course, taking you through until midnight. And they have got a pair of Coldplay tickets up for grabs. Yep. Legendary band is coming to the UAE, Abu Dhabi, in fact, in less than 2 weeks. So if you didn't manage to get hands on those tickets, keep your fingers crossed. You could be going into 2025 as a winner. Dr. Ayman El-Hattab is with us, consultant in clinical genetics. We've been talking about the premarital screening programme for all Emiratis, which is coming into play early January as part of the Ministry of Health and Prevention, mandatory genetic testing. But open this conversation up to us adults being tested, if we've already had children, or indeed our kids as well. So we've had a number of questions on 4001 and some anonymous ones, and understandably so. Anonymous asking here, for couples who are struggling with fertility, unexplained fertility, how does genetic testing help and how does it work with treatments to ensure a healthy baby? Good question. I think for so many couples, that unexplained piece is, the most upsetting, the most frustrating because, you're not getting the answers. Can genetic testing play a role in that?
Yes, in making diagnosis, because sometimes infertility is caused by genetic defects. So both the husband and wife, they can be tested and we can find out the reason, if the reason is genetic testing. So yes, infertility is an indication to perform genetic testing.
Lola's saying, hi guys, what happens if only one of us is found to be a carrier for a condition? Does that still pose a risk to our future children?
So if we are talking about recessive diseases, no, it will not cause a risk for the person himself or herself or her children. Both husband and wife should carry the same recessive disease to have an affected child. If one is carrier, then nothing will happen. And
Chris saying, thank you for raising awareness on this. How much does it cost? Thank you, Chris. I appreciate your forthrightness. I think that's important because we know kids are expensive, and there sounds like could they be expensive before you even have them?
I mean, relatively, yes, it's expensive. Over the last years, with the advancement in technology, the prices came down. Now, let's talk about the test for all the genes, or what we call it whole exome sequencing. Now, the cost is around 1,000 US dollar, between 3 and 4,000 dirhams.
But then I think about when I, with my second pregnancy, had to have that, is it NIPT test for Down syndrome? I remember that being about 1,500 dirhams. And that was the first kind of stage in that. To my mind, I actually think for peace of mind, and as you rightly say, when you think about, you know, treatments that you might undergo, you know, if there does need to be a termination for health reasons, or indeed you go on to have a baby that does have a genetic problem, then I think that's money well spent. My last question to you, though, Doctor, is for people listening today who have got concerns, there's red flags, or they want to be proactive in terms of their health and that of their future children. Do you go to your GP and you ask for a referral? Do you send me the word doctor and I send you your details and you can go to you direct? How does it work logistically?
So before performing genetic testing, it's very useful to do what we call it pre-test counseling. So we need to first of all evaluate the case and collect information and discuss with the couple or with the family about genetic testing and what to do and what to expect. So this part is better to be done by someone who's specialized, and then to select the proper test. And after the results, again, we typically see these people again to do the post-test counseling, where we explain the results and the implications of the results.
Thank you so much for coming in, especially on New Year's Eve. But I think, as you rightly say, you know, this initiative in the premarital screening for Emiratis planning to marry, you know, really does show the commitment to proactive healthcare and prevention of genetic diseases here in the UAE, but really valuable to raise awareness when it comes to genetic cancers, to do with rare diseases, something I know you're really passionate about. So Dr. Ayman El-Hattab, thank you for joining us today. Really appreciate it. You can find Dr. Ayman, as I said, in Abu Dhabi and Al Ain, and here in Dubai at Agenesis. If you want his details, just send me the word doctor. That's me signing off. Of course, we're taking care of you all the way through until midnight and beyond. But for the last show of 2024, I'm out. Happy New Year's Eve.
This is Dubai Eye 103.8.
The UAE's #1 talk radio station.